hope I'm audible and visible. Sachi, Javed, Ishyara, Manish, Dr. Bhuvana, Yogesh, Tara, please give me a quick thumbs up if my audio video is all fine. Chalo, very nice, very nice. So welcome in this afternoon session of chapter-wise discussion, Dermatology Part 3. We have discussed already in the day before yesterday and yesterday's session the basics of skin and the questions related to appendageal disorders. Specifically, we have kept sebaceous gland disorders like acne and hair disorder as the part of yesterday's session. Now, today in this session, we will be discussing the systemic part. That is, we will start with the vesiculobullous disorder today. So I request all my dear students to please join as fast as possible. Now, let us begin with some of the regulars on Unacademy. I'm Dr. Chesta Agarwal, your NEET PG educator, and you are on the best online platform for the preparation of NEET PG. Now, I do take a lot of special classes. One is at 11 a.m. and another is at 2 p.m. as you all are attending. And we will be following these classes every day, except on Sundays where you don't have any afternoon sessions. So I request all my dear students to please follow me, my profile, so that you can get all the notifications of my classes. Now we have two types of plus subscription. We have two types of paid subscription. One is plus, which give you an access to Unacademy, live and recorded sessions. You can access through any electronic device, and you are taught by all the top educators of this country for their respective subjects. On Iconic, you get the advantage of two online platforms. One is Unacademy and another is Prep Ladder. So you have benefit of two online platforms with a single subscription. New batches like Focus FMG, and a target next batch is in the line of getting started. So it will start from today. I request all my dear students to please be a part of it. Now we have few more batches. For example, the NEET PG TND batch and Ultra Fast Track Revision batch will also start from today. And I would recommend all my dear students, please do not miss on these batch courses. Very, very important. Take a 2-month subscription. Use my code CHESTA10 and get yourself enrolled. We have around 12 GTs which are scheduled in these batch courses. You have daily analysis of the questions. There are daily tests, subject-wise or grant. 4-year subscriptions are also available. 60,000 for plus, 75 per Iconic. And this is what I was telling you. The 2-month subscription, which is very, very important for all of you right now. This will help you understand that which topic is very important or frequently asked in your exam. They will also revise PYQs. They will also revise PYQs in this particular batch course, and that is why I request all my dear students to please take it. Use my code for subscription. 2 months of 6750 rupees only. Now this is a limited time period offer for Iconic. We have revised prices, and remember, today is the last date. Today is the last date of revised prices. We are increasing it from 5th of August, from tomorrow. So I request all those who are still in their first year, second year MBBS, or those who are eligible for next pattern examination, requesting all my dear students to please take either a 1 year or longer subscription of Iconic. You get notes, you get access to Prep Ladder and Unacademy all together. And this is the price list of Plus and Iconic. The Plus, we have 2-month subscription for NEET PG, which is best. The 3-month subscription I would recommend for FMG, and 1-year subscription for either Plus or Iconic for your next pattern examination. Clear? So please take my code whenever you subscribe to get additional 10% discount on the subscription fees. Now please give me a quick thumbs up if you all are ready for the first question of the today's session. The today's topic is the vesiculobullous disorder, a very interesting and amazing topic, and you will love this topic today. We'll discuss everything which is required. Yes. So after sequential arrangement of the blistering disorder, starting from the superficial to the deep, which among these is the deepest? Time starts now. 30 seconds on your screen. Only 29% have answered this question till now. So that is a very, very poor performance if you are answering the questions of vesiculobullous disorders like this. So please assess yourself which topic is weak, which is strong, and please start preparing. That is my humble request to all of you. Vesiculobullous disorders, papillosquamous disorder, you can expect a lot of questions. Histopath, DIF findings, treatment part, clinical feature, everything is important. So only 32% out of total 80 students right now live on my screen. So Priyanka, Shweta, Krishnai, Pradeep, then we have Gautam, Gautman, Ria, Salman, Liga, Hardik, Manish. Very nice, all my dear students. So look at this question. Look at this question. What is given here? That you have to arrange them from superficial to deep, and you have to tell which of the following is deepest. Iga Pemphigus. Actually, Iga Pemphigus or Iga Pemphigoid is almost same. Okay, ji? And what happens here in this, you have IgA antibodies directed against the basement membrane zone structures. So if you know, we have three parts. We have epidermis, we have basement membrane, and we have dermis. In IgA pemphigoid, you have antibodies against the basement membrane zone. In Pemphigus vulgaris, you have antibodies against the intercellular component. And what is that? That is desmoglein. So IgG against the intercellular component of epidermis. And in bullous pemphigoid, again you have IgG, but against the basement membrane zone. So PV is at the top, that is superficial. And at the basement membrane level, you have bullous pemphigoid and IgA pemphigoid. Now, what about Epidermolysis bullosa dystrophica? Against which component you see antibodies in this group? Anyone? Anybody can tell me the answer? Yes. Here there is no antibody. Here there is no antibody, but there is congenital deficiency of one of the component of dermis, and that is collagen 7. Understood or not? Very, very important, all my dear students, and that is why dermis is the deepest part, and that becomes the correct answer for this particular question. Anyone has any confusion, let me know. Very, very important for your understanding. You can expect a lot of questions, and for detailed discussion, please join my plus course. I will discuss in detail what are the different layers of epidermis, what are the different layers of basement membrane zone, and what are the components of the dermis. This is very, very important. Yes, Gautama, IgA pemphigoid and linear IgA is same. IgA pemphigoid and linear IgA is same. Understood? And what is IgA pemphigus? It is a variant where you see intercellular deposits of IgA, and it is I hope you know that is something called as subcorneal pustular dermatosis. So it relates somewhat with that. You have subcorneal pustules which develops because of accumulation of lot of IgA, and there is accumulation or recruitment of the inflammatory mediators. Okay, clear all of you? Salman, that is what I'm trying to tell. The mechanobullous disorder, that is EB dystrophica, junctional and simplex, very important topic for your exam. And for understanding it in detail, please follow my plus course. You can use my referral code Chesta10 and subscribe to the plus subscription. You can expect 1 or 2 questions for sure in your exam from this particular topic. Okay, I think we got in INI-CT also there was one question on histopathology. I hope you all remember on Pemphigus vulgaris. Yes, so it is a very important topic and you cannot take chance to miss it. Okay, should I go to the next question? Ready all of you? Amazing. Chalo ji. Good. Next question on your screen. All my dear students, if you want to understand the topic in detail, I do take them in my plus courses. The vesiculobullous disorder, very important for your exam. Subscribe to Unacademy, use the code Chesta10. Very nice, Sonali, Seat, Dr. Fatima, Soham, Krishnai, Rutuja, Yogesh, Manish, Himangi, Ardha, Sheetal, amazing all of you. Very nice. So red scaling lesions are seen in, not seen in. I hope you are clear with this. Now please remember, Whenever they say scaling, it means they are asking you about papulosquamous disorders. I hope you remember this. Papule means raised lesion of less than 0.5 or 1 centimeter, and squamous means scales. So whenever they give red scaly lesions, it means they're asking you about the papulosquamous lesions. And can anybody tell me which among the following is not an example of papulosquamous lesion? Anyone can tell me which among the following is not an example of papulosquamous disorder? Amazing, very nice. It is dermatitis herpetiformis, which is actually a gluten-sensitive enteropathies cutaneous manifestation which presents with erosions and crusting over the extensors. I hope you remember the image, the clinical appearance. In these patients, because of cross-reacting antibodies, you have IgA type of antibodies against tissue transglutaminase, which actually cross-react with the epidermal transglutaminase, which is present at the dermal papillary tip, present on the dermal papillary tip. And because of this, you see accumulation of a lot of inflammatory infiltrate at dermal papillary tip, and you can see a classical granular type of IgA deposits on DIF. Clear, all of you? So you will see erosions and crusting. There will be no scales. Please remember this point. No scales. There will be erosions and crust. You will have a lot of itching associated, and that is why you hardly see any intact vesicles. You only see presence of erosions and crust. Clear or not? Please say yes if it is clear. Now let's see how does the other three options look like. Starting with tinea cruris, can you tell me how to describe a lesion of tinea? What is the appearance classically known as? Yes, you're right, Dr. Sonali. The appearance of DH is over the extensors. Okay? Tinea cruris always presents with an annular lesion which have central clearing. Can you see? It's an annular lesion. The margins are erythematous, scaling in the margins, and you can see there are clear centers. So this is how an annular lesion of tinea look like, and this comes under a red scaly lesion DD. Tinea cruris comes under the differential diagnosis of red scaly lesions. Psoriasis, the classical lesion is you have well-defined red or erythematous or salmon-colored papule or plaque with silvery scales. Gorish, no purple. You will never use the word purple for psoriasis. Remember, never use the word purple. It completely changed the concept. So you will never use the word purple. Purple is for lichen planus. Yes. So don't remember purple. Remember red or erythematous or salmon color with silvery scales. So again, psoriasis becomes one of the DD of red scaly lesions. And then comes the secondary syphilis. I hope you remember, I told you secondary syphilis is a great imitator. It can have any type of presentation. Whether it is a papule, pustule, scale. But can you tell me which lesion you will never see in a patient of secondary syphilis? Amazing. You will never see vesicles. Otherwise, red lesions, scaly lesions, everything is seen, and that is why secondary syphilis also comes in one of the DD of red scaly lesions. So I hope this question becomes absolutely clear. You have no scales in dermatitis herpetiformis. You have only erosions plus crust. Okay? Clear? Anyone has any confusion? Again, I'm telling you, if you want to learn them in detail, please subscribe to the Plus course using the referral code Chesta. Let's move to the next question. आगे बढ़ें, all of you. चलो, fine. Very nice, all of you. Amazing. Sarvesh, Rutuja, Dr. Baby, Krishna, Adi, Shweta, Anshu. Desley, very well done. Again, only less than 39%. Only less than 39%. Dr. Sonali, Ria, please do not make this mistake of not reading except here. You cannot take that risk again. Okay, so please, this except word, they will give in a small letters at the end. They will give you all are true except or please answer the false statement. These are some of the very, very frequently asked questions. So please do not make this mistake. Very important for your exam. Chalo. So I think everybody was aware about the question, but they have not read the except, and that is why it becomes wrong for them. I guess that was the only case. Okay. In Pemphigus vulgaris, you will see autoantibodies, IgG type, against both desmoglein 3 as well as desmoglein 1. And in some part, there is little activation of the complement. And whenever you have activation of complement, there is accumulation of C3. So you can have IgG against desmoglein 1. You will have deposits of IgG and C3, and you will have antibodies against desmoglein 3. But this is not correct. And can you tell me for which disease this line is correct? What is the diagnosis when they tells you that you have IgG against hemidesmosome? Amazing. It becomes a case of bullous pemphigoid. Amazing. ठीक है जी, bullous pemphigoid. So this becomes a very, very classical question, and you have the image also associated. You can see a fishnet pattern. Fishnet pattern. Or what is the another pattern? Chicken wire. Fishnet or chicken wire pattern seen in the patients of Pemphigus vulgaris or Pemphigus foliaceus. Amazing. So I think this question is also done. Let's move to the next question. All of you, please quickly answer this question. Very nice. All my dear students, amazing. The question is, what is the diagnosis? They have not given you anything from the history part. You just have to look at the clinical feature, look at the clinical image which is provided. Okay, ji. So very nice. And this is the question which actually you all got in your INI-CT. But I have told this question before itself, and I think now nobody will make mistake. Now please listen to me for the next few minutes. Whenever you get a question from histopathology of skin, always try to identify whether the pathology lies in the epidermis or dermis. Now please look at this image. Now I hope you can make out that this is the dermo-epidermal junction. Please give me a thumbs up if you can make at least this much. So this is the epidermis and this is the dermis. Clear, all of you? This is the dermis and this is the epidermis. Now please remember, there is a gap which is seen in the epidermis which is not normal. In general, the epidermis as a whole looks very normal. So the pathology lies in the epidermis. Now, what is seen? You can see a white space which is actually a bulla, and this bulla is present just above the stratum basal layer. So this becomes a classical case of supra-basal cleft. And you can see these cells floating. What are these cells? Can you tell me what are these cells which are floating inside? Yes. Acantholytic cells which are floating inside. And this becomes a classical case of or question of Pemphigus vulgaris. this becomes a classical case or question of pemphigus vulgaris. Clear, all of you? So you can expect these questions in your upcoming entrance examination, that is NEET PG also. And if anybody is for FMG, again, same thing with you as well. Okay. Yes, this is the row of tombstone. Can you see this part? Can you see this part? You can see the cells arranged like this. Stratum basal. Now they are connected to the stratum basal, but they are not connected to each other. And this is because the hemidesmosome is intact, but the desmosome is gone. Understood, all of you? Please give me a thumbs up if you understood. So this is called as row of tombstone appearance. Chalo ji. Badhiya. Should we go to the next question? All of you ready? ठीक है जी. Your time starts now. I think it's a candy question for all of you. It's a very easy candy question. Very nice. So which of the following histopath feature of pemphigus? Yes, so there is no except here, and at least try to look. It is always better to search for these words like true, false, except. You know, these words are googly words which they give you somewhere in the question, and it's there in your mind that you will tend to forget that word. You'll read everything but not that word. Okay, ji. So I think it's a very easy question. It is a classical case of acantholysis, and I told you acantholysis means whenever the cells of stratum spinosum, which are closely adhered to each other, they get separated like this. They form a classical acantholytic cells which are round with a large central nucleus and a perinuclear halo. So I think there's no confusion with this particular question. Let's move to another question. Very nice. Tara, Lipsa, Vidashri, Lavanya, Shehtaj, Priscilla, Pradeep, Sheetal, Dr. Grace, Shrijit, Delphi, Rohit. Very nice, all my dear students. Very nice, all my dear students. Okay, so okay, so yes, so only one student has written it correctly, Ishiara. Please remember all the other students. Yes, it is a tense lesion, but Ria, you will see tense lesion in linear IgA disease also, right? What is linear IgA disease? You have IgA antibodies against the component of basement membrane zone. So obviously, this will also present with the tense bulla. So this statement is correct. But what is the difference then? You have to look for the image. There's a purpose. They have given you the image. And if you look at the image, I'm zooming this for you. Can you see a large central settled bulla? And there are multiple small vesicles present on the periphery. This is a very classical image. Actually, you hardly see them because of itching, the patient tend to cause a lot of excoriations and the itching is gone. Yes, chronic bullous dermatosis of childhood is same of the linear IgA disease, and chronic bullous dermatosis is same. Okay, ji? Understood, Dr. Baby? It is same. So please remember, it is a classical case of linear IgA dermatosis or disease, not bullous pemphigoid. And linear IgA disease is also known as chronic bullous dermatosis of childhood. And here this is known as cluster of jewel appearance or string of pearls. cluster of jewel or string of pearl appearance. Remember, it is very common at 5 years of age. You can see it in elderly also, Shweta and Ishihara. We have two types of linear IgA disease, the childhood variant and the adult variant. Childhood variant is most common at 5 years, where you have classical cluster of jewel appearance. In adult phase, you will have less amount of these cluster of jewel features, but you will have more of oral lesions, which is seen in the adult variant. Okay? Clear? Salman, I hope I was able to clear your doubt as well. And we are done with this question. Everybody is clear with this particular question? Fine. Chalo, let's move to the next question. Always less than 50%. So I think it's a high time you start revising dermatology. Yogesh, Vaishnavi, Vedashri, very nice. Rutuja, Sippy, Tulika, Dr. Baby, Bindya, Tara, very nice all of you. This is a classical case of Pemphigus vulgaris, which will present with oral erosions. It may have lesions initially at flexures, but they later becomes generalized. It's a chronic disease, yes. It is not self-limiting. It occurs for a very longer duration. And if you not give any treatment, it can have a worse prognosis. Nikolsky sign and Bullaspet sign is positive. On rank, you will see acantholytic cells. But please remember, you will have intercellular deposits. You have intercellular deposits in the patients of Pemphigus vulgaris. The linear deposits is a feature of bullous pemphigoid. Very nice. This is a feature of bullous pemphigoid. I hope now it becomes easy for you to understand. Clear? Now quickly move. I think we should go to the next question without any delay. Very nice, very nice. Nikolsky sign is a clinical sign. Nikolsky is a clinical sign. When you give a lateral pressure, you will see that the skin will give away. The skin will peel. So that peeling of skin is called as Nikolsky sign, and that actually gives you an idea that the disease is active. The attachment between the cells is defective, and that is why it is giving away. Okay, ji? The skin is peeling, so it is a clinical sign. I think this is a very easy question. Intercellular deposits with oral lesions with flaccid bullae becomes a classical case of Pemphigus vulgaris. And we have one more question. I want you to solve this also. Again, very nice, very nice. Kritika, Somna, Lega, Anshu, Rutuja. Oral lesions with supravasal cleft, and you can see a characteristic fish net pattern or chicken wire pattern. So there's no doubt that this is a case of Pemphigus vulgaris, and option number 2 becomes the correct answer here. So with this, we are done with the today's session. I hope everyone have enjoyed this. Please try to attend the plus courses, because the vesiculobullous disorder is a very important topic. Psoriasis is a very important topic. And that is why I'm telling you to please take a 2-month subscription using the code Chesta10. It is for 6,750 rupees for 2 months. So thank you all of you. Bye-bye. Take care. Ma'am, PV lesion is stratum spinosum. Yes, at the lower level of the stratum spinosum. You are right, Dr. Salman. Okay, ji? So bye-bye. Take care, everyone. We'll meet tomorrow at 11 a.m. and 2 p.m. Till then, take care and good day.